Within a week of conception, your fertilized egg, known as a blastocyst, will make its way to your uterus. The egg is about the size of a pen tip. In days, the cells in the egg arrange themselves in two groupings. The inner cell mass will become your baby. The outer cells will become the amniotic sac and placenta. The blastocyst then sheds its protective casing in a process called hatching and burrows into the large uterine wall. Around week 5, your developing baby is the size of a semi-seed. The cells that once formed the blastocyst inner cell mass begin organizing and arranging, giving shape to the young embryo and forming primitive organs. Your baby's brain and spinal cord are visible through his translucent skin. Right around this time, your baby's circulatory system also forms, and his heart begins to beat. Your baby looks more like a tiny tadpole than a human. He's drawing nutrients and oxygen through the newly formed placenta and umbilical cord. By week 9, the embryonic tail is gone. Your baby is looking more human every day. With protruding limbs and fingers, a defined nose, mouth and eyes, and tiny earlobes, your new resident is about the size of a grape and weighs a fraction of an ounce. It hurts to believe how rapidly one cell evolves in such a short time into an unmistakable body of a baby. At 10 weeks and barely the size of a kumquat, your baby is entering the fetal stage of development. His facial features are defined and his tooth buds are forming. Over the next weeks, his tissues and organs will rapidly grow and mature. The webbing is gone between his fingers and toes, and his nails and fingerprints are developing. Your baby can open and close his fists and square his toes. Thanks to his developing muscles and reflexes, he's now moving his limbs and kicking up a storm. If this is your first baby, though you likely won't feel his flatus until 18 to 20 weeks. Through translucent skin, his vital organs are visible and functioning, including his growing brain, nervous system, intestines, and liver, which is making red blood cells in place of the disappearing yolk sac. The umbilical cord is working hard now. One vein delivers oxygen and nutrient-rich blood to your baby. 2 arteries then carry the blood away. Around week 12, the kidneys have begun producing urine, which your baby will soon start excreting into the amniotic fluid. He will swallow the fluid, and the process will begin again. By week 14, your baby's eyes and ears have moved into place, and he can squint, frown, and grimace. You are now beginning the second trimester of pregnancy, which many women say is when they feel their best.